Hey teams, Lauren here with BIZROK. In this week's video, I want to talk about specifically the handoff to the front. And I know that we've covered this previously, but hear me out, guys. This is where I see the ball get dropped the most, is because we get rushing around in the practice and we forget to do all of the parts. And then there's confusion for the patient. And then we wonder why case acceptance is really low. Guys, every single person in the practice has an impact on case acceptance, but clinical team, it starts with how you hand off and move the patient from the back to the front. Now, I know every single practice, everybody watching, you guys all have totally and completely different setups, okay? I know that. So keeping that in mind, I still want you to hear me out. I know that most of you are from a very busy office. Clinical team, I know that you're trying to take your patient up front because your next patient is here and you still have to flip your room, okay? Hear me out though. Sometimes those are things outside of your control. You still have to serve the patient to the very best of your ability, because here's what's not great and here's what's not going to help your case acceptance. Whenever you dump a patient up off at the front, there's no great communication between you and the checkout coordinator, and then you're rushing to get your room flipped only to be rushing to get the next patient pulled to the back. See, what you're doing is you're leaving the one patient with a good instead of an exceptional experience, and then with the second patient, you're starting them off on simply a poor or a good experience instead of exceptional, okay? So hear me out. Whenever you are going to the front, make sure that you stay with your patient until that checkout coordinator is ready to take them. Now, for some of you, if you're using route slips, which guys, I love a paper route slip. That's another video for another day. But a route slip is a really, really great way to communicate to the checkout coordinator on everything that was done that day, next steps, and next appointments, okay? So if you're not using that and you're cringing when I say stay with your patient, then you should absolutely be implementing route slips, okay? So imagine this, you're with your patient, they had a great appointment for you. Maybe they just came in for a limited, but they're coming back in for a full comprehensive exam, a small filling, and then a crown. Like, great. Okay. Typical treatment plan, totally fine. So you go to the checkout coordinator. That's when you should be spending connection and additional time with your patient before handing them off to the checkout coordinator, especially if that person is either on the phone or has somebody else that they're checking out. Guys, clinical team, I need you to hear me on this, okay? I promise you that checkout coordinator feels your presence, knows that you're waiting on them, and desperately wants to get off the phone with that patient or finish checking out that patient in front of them so that they can take care of your patient next. I promise you that is going through the back of their mind. They're trying to juggle all those things just like you are with your current patient and the one that's in the welcome area waiting, okay? So do me a favor. Give them 2 minutes. So whenever that checkout coordinator is on the phone or with a patient, give them 2 minutes. Talk with your patient a little bit more. So do you have any plans for the rest of the day? Do you have any other clinical questions for me before you come back in and see us? Make sure you're in HIPAA compliant and you're not talking about the treatment plan right in front of other patients. But you can say, do you have any other clinical questions for me before Susie checkout takes great care of you? What other plans do you have today? Do you have anything fun going on this weekend? Just buy a little bit of time, which guys, it's not unproductive time. You're strengthening that bond and that relationship and that rapport with your patient and helping your checkout coordinator to juggle everything he or she is trying to juggle, okay? Now, if you have a route slip and you have the capabilities, you can also hand deliver that route slip to the checkout coordinator, still spend a couple minutes with that patient, but hand that route slip to the checkout coordinator, spend that time with the patient. And if you're like, I really do have to go, I've spent the 2 minutes, the checkout coordinator has the route slip, it is okay at that point in time to direct the patient where to sit. You know, some of our offices have a couple seats at the checkout area. Some of our other offices, they don't, but they have extra seats in the welcome area. Direct the patient there. Hey, Susie patient, Miss Carol is finishing up with this patient or finishing up a call. I know that she knows that you are waiting and ready to check out. She's going to be with you any moment. Do you have any other clinical questions for me? Great. I've already given her your route slip, which goes over everything that we did today, plus what you're coming back in to see Dr. Smith for. If you don't mind, if you'll just wait in the welcome area, I promise she will call you back as soon as possible. Now you've set the stage for that patient, started to build a little bit of authority for Miss Carol, and set the tone of, all right, Susie, check out. It's your turn. Like, I need you to get ready to take care of my patient. Here's the route slip so that you and I are in the loop, okay? That's like worst case scenario whenever there's a traffic jam at checkout and there's too many things going on and you have to hand off the patient somewhere else in the office, okay? Now, in a perfect scenario, you are in the back and you are radioing to the front, like op 3 ready for checkout, which gives my my front office team a heads up that I'm about to walk up front with my patient. I'm in op 3 and I'm about to walk out with that patient. Guys, there's so many sidebar conversations we can have on this. Why it's important to have operatories labeled correctly, team members be assigned to different operatories, radios in the office for simple and brief communication from the back to the front. And then a really, really stellar internal communication is giving the front office a heads up that there's a treatment plan in there. So I might say, op 3 ready for checkout, treatment plan in place. Op 3, I'm coming to checkout and I've already put a treatment plan in place. If you can print it, that's what that means, guys. That's internal code. So whenever I'm the clinician, I'm the hygienist, the assistant, or even the doctor walking my patient up front to check out, if I'm the checkout coordinator, that told me, okay, she's about to come up with that patient. I better pull up that patient and print out their treatment plan because she's coming up with it, right? So whenever the clinical team comes up, I've already got the treatment plan and I'm ready to go, guys. I'm ready to talk through some of the financial arrangements with my patient. But clinical team, we don't stop there yet, right? So remember, if you have that route slip, it should say everything that happened that day. If there were any updates on what was scheduled, you should be updating that, handwriting that onto the route slip, cross something out and write something next to it. And then future treatment, you wanna know, is it ASAP? Does the doctor want that patient in as quickly as possible? When can it be scheduled? How many units does the doctor need? Why? Because even though doctors have kind of a set time limit, I've got to pause, sorry, I've got an itch. Even though doctors typically have a set time limit on different types of procedures and how long it typically takes, I know our doctors, and there's always one doctor per day, per patient, who's like, yeah, but I could see this patient, and instead of 90 minutes, I can do it in 70 minutes. Guys, those are different units, and so we need different time frames to schedule that patient appropriately, okay? So we should have those templates in place for services and units needed, but give yourself the opportunity to be set up for success. Hygienists and assistants always, always, always say, Doc, how many units do you need for that appointment? It just gets them in the habit of always giving you units, and then you can quickly write it on the route slip, okay? So you go to checkout and you say, Susie, patient, this is Miss Carol. She's gonna take great care of you. She's our checkout coordinator, plus she's a financial coordinator. She can go through all of the different financial options to make sure that you're taken care of. Carol, Susie was a great patient for me. We did this, this, and this today. I've already got her scheduled to come back and see Dr. Smith, and here's what we're doing in that next appointment. Then look back at your patient. Susie, do you have any other clinical questions for me before Carol takes great care of you? Guys, I know you already asked that question in the back. I promise I do. And I don't know why this happens in dentistry, but I swear this weird walk of amnesia from the clinical operatory to the front where the patient instantly forgets, so what am I coming back for, or what do we do today? And so whenever you give the patient one more opportunity to ask additional clinical questions, you save the front office team a whole heck of a lot of headache from having to either re-explain and re-educate to the patient, call you back to the front to re-educate the patient, or just have unnecessary time spent. So asking that is such an important handoff question. Plus it tells the patient, I'm the clinician. Are there clinical questions you have for me before I leave? Because Miss Carol is gonna talk about the financial side, okay? So make sure that you're practicing that. I know your front office team will thank you. Front office team, make sure that you're setting your clinical team up for success, but we'll cover that in next week's video. As always, guys, if you need anything, reach out to us. Otherwise, we can't wait to see you and serve you soon.